Hi, and welcome to the informational video series on the rules for certified family. This is video number 2, and we will cover definitions, policies, emergency preparedness, children's records, immunization, and parental permissions. My name is Amy Bowie. I work for the Child Care Licensing Division as a licensing specialist in the Tualatin Field Unit. The Child Care Licensing Division hopes that you find these videos informative and supportive and learning about the new Certified Family Rule Set. During each video in this series, we will explain some of the key features and highlights of the Certified Family Rules. Another new aspect is that the rules have been organized differently to help make information easier to find. While we are highlighting many key features, changes, and new rules throughout this video series, the entire rule set will not be reviewed. Please refer to the Certified Family Rulebook for the full list of requirements and rules. Okay, let's get started. Definitions are a way to support the rules for childcare, ensuring the rules apply as intended. There have been several significant changes and additions to the definitions section. One significant change is the replacement of child-proof lock with inaccessible to children. This change broadens the language and provides more flexibility for childcare providers to use various methods to ensure that hazards, toxins, and potentially dangerous equipment are maintained and accessible to children. So while child-proof locks are still an option, you can now explore other safe and effective ways to prevent access to a variety of hazards. Some other definition updates include, but are not limited to, child with specific needs, developmentally appropriate, physical restraint, play yard, and supervision. Let's take a look at some updates related to policies and the communication of those policies to staff, volunteers, and parents. First, staff, volunteers, and parents are now required to receive copies of your policies in electronic or paper format and be notified whenever there are any changes to them. This ensures that everyone involved is fully informed and aware of the expectations and guidelines that govern your program. Next, the declaration of viewing, which was previously required, is no longer necessary. While it's still important for everyone to view and acknowledge your license, there is no longer a formal written declaration confirming that it has been viewed. These updates are designed to enhance transparency and communication within your child care program. Next, let's review the rule updates regarding your emergency preparedness and evacuation plans. These are crucial for ensuring that you're prepared in case of an emergency and that your program complies with the new rules. You must have and maintain a written emergency preparedness plan that addresses evacuation, relocation, shelter in place, lockdown procedures, and responding to medical emergencies and other incidents. The new rule states that you must review the written evacuation plan and all emergency procedures at least once per licensing period and update them as necessary. You must identify a hospital or clinic for emergency medical care. For evacuation purposes, your designated safe areas and alternate shelters must be located at least 50 feet away from the building being evacuated. This distance ensures that everyone is safe from potential hazards or further risks. The new rules address weather conditions, temperatures, and air quality. This update requires you to account for these factors in your emergency plans. You'll need to consider possible extreme temperatures or poor air quality that might affect the safety of children during an evacuation or sheltering in place. You will also need to ensure you have an emergency light source, such as a flashlight, in working condition. These changes are designed to improve safety and ensure that your program is well prepared for emergencies, no matter what kind of situation arises. Now let's move on to updates related to child enrollment forms and the information you'll need to maintain for each child in your care. You now have the flexibility to store children's records either in paper or electronic format. The key is to ensure that the records are easily accessible and securely stored, regardless of the format. The requirement to include a child's dentist information on the enrollment form has been removed and is no longer required to be collected. Another change is that you must now document that parents have received a copy of your policies. It's an important step to ensure that parents are fully informed about the expectations and guidelines of your child care program. A new requirement is for parents or guardians to review, update, and sign or initial their child's enrollment form at least annually, verifying the information is accurate. These changes are meant to streamline enrollment procedures while ensuring that key information is collected and is stored appropriately. Now, let's cover an important update regarding immunizations and how they relate to your child care program. If a child is enrolled in a public or private elementary school, you are no longer required to document their immunizations in their child care file. Immunization records will already be tracked through the school system, and it is understood that the school will meet the necessary requirements for immunizations. The rules have also been updated to allow more flexibility in situations where children may not yet have their immunizations up to date. You may provide care for children who are in foster care or experiencing homelessness, even if their immunizations are not fully up to date at the time of enrollment. This allows parents or guardians the time needed to take the necessary actions to comply with immunization requirements. These updates ensure that your program can accommodate all children, even if they are in situations where documentation or full immunization compliance is temporarily unavailable. Next, we'll discuss the rule updates around parent permissions and when they are required for your child care program. You must have current written permission from the parents for their child regarding certain activities, and these include: written permission must be obtained before child care children engage in high-risk activities, such as swimming, mountain biking, or any other potentially risky activity. If you plan to use photographs or recordings of a child for public purposes, such as on social media, in advertisements, or other public-facing materials, parental permission is required before doing so. For chronic medical conditions, you may obtain permission with specific instructions when administering medication for up to 12 months. Examples include diaper cream and inhalers. Now, if a family is experiencing homelessness, there is flexibility in cases where written permission is not obtainable due to the family's circumstances. Permissions can be provided verbally as long as you document the date and time you were given permission and maintain it in the child's file. Electronic permission, such as through a text message or email, can also be used as an accepted form of permission. These updates ensure that child care programs maintain appropriate consent while also being sensitive to the circumstances of families who may be facing challenges. Thank you. for watching this video in our informational video series. You can now move on to the next video in this series. If you have any questions, please contact your licensing specialist. For more information, visit our website at www.oregon.gov/delk.